Right, well, we get going. We've quite a busy session today. So I'll go through the agenda. We'll do welcome and introductions as usual. I'll hand over to Barry, who will give an overview of the key messages. And we've got Sarah joining us this evening, who is a champion and also runs a peer support group, and she's going to talk to us about that. Then we'll go into Champions Corner. So if you've any questions, you'd like to raise any issues or any points, please do in Champions Corner. But as always, you can use the chat box throughout the session. Today we have Sylvia and Anita joining us from the public health team, and they're going to go through the early analysis of Covid impacts on BAME populations in Merton. And we'll have time for questions and a discussion on this, and we'll have next steps, and then we'll finish by 8. So introductions, we don't have too big a group this evening, so I think we can run through in-person introductions. Angela, do you want to start us off and introduce yourself?
Hello, I'm Angela from Faith in Action, Merton Homeless Project. Thank you.
Hi, Angela. Anita, would you like to introduce yourself? Oh, you're on mute, Anita.
Yeah, we all go on mute at this time of the evening. Good evening, everyone. I'm Anita. I'm the Senior Public Health Principal.
Thanks, Anita. Barry, would you like to introduce yourself?
Yeah, hi everybody. I'm Barry Causer from the Merton Council Public Health team.
Thanks, Barry. Erica, would you like to introduce yourself?
Hi, I'm Leoka Norford, Merton resident and a Royal Volunteer.
Thanks, Leoka.
Volunteer. Thank you.
Erica, would you like to introduce yourself?
Hi, good evening. I'm Erica, and I just joined you recently, the second time that I'm attending your evening meetings, and I'm looking for some opportunities to help out or volunteer, and that was the reason mainly that I joined you. Thank you.
Thanks for joining us, Erica. Sarah, would you like to introduce yourself?
Yeah, hi guys, I'm Sarah. I run a consultancy in inclusion. I'm here today to chat about my peer support group in a minute, so I'll talk with them. Cheers.
Thanks, Sarah. Karen, would you like to introduce yourself?
Yeah, I'm Karen. I'm a Merton resident. I do some volunteering within the borough.
Thanks, Karen. Mark, would you like to introduce yourself? Maureen, would you like to introduce yourself?
Hi, I'm Maureen Carruthers, and I work for the Royal Marsden as a Director of Nursing, and I joined the volunteers 2 weeks ago.
Thanks for joining us, Maureen.
Okay.
Sylvia, would you like to introduce yourself?
Hi everyone, so I'm Sylvia Gary, consultant in public health at Merton. Nice to meet you all.
Thanks, Sylvia. And Tracy, would you like to introduce yourself?
Hi, I'm Tracy Brown and I'm a Merton resident and pass information onto neighbours and onto Facebook and Nextdoor.
Thanks, Tracy. And hi everyone, Una O'Brien from the public health team in Merton as well, for any new champions joining us. Housekeeping, so you can have your camera on or off throughout the session, but we do ask that you mute your microphone when you're not speaking, just so we can hear people who are, and there's no feedback. And I'm going to hand you over to Barry now, who's going to give an overview of this week's key messages.
Thanks, Una, and thank you, champions, for coming back again, and particular thanks to Sarah for coming back to the second session of the day to talk about her programme. So thank you, Sarah. Champions, some cautious optimism from me this evening. We've continued to see that cases are falling. So that really challenging and that really difficult lockdown period has worked. It has had the effects that we wanted it to have. And so we're now starting to think about opening up. So we've got now kind of one eye on what the government is going to announce on how we open up things slowly and safely. And in Champions Corner, be really interested to hear from champions on what you're thinking about that, whether it's causing anxiety or whether you're really looking forward to that opening up in a calm and effective way. So that's really positive for us that those cases are continuing to fall. The NHS indicators are also going in the right way, I'm really pleased to say. So the numbers of inpatients are reducing, the numbers of our residents in intensive care are reducing, and I'm really pleased to say that although still relatively high, the number of deaths are reducing too. So the indicators are going in the right way, but the NHS is still under pressure, and we really do need to stay at home to protect the NHS. So as we've got that one eye on the future, and it's kind of just recapping the things that we've spoken about before, champions. Test and trace is a key part of our approach to controlling that virus spread. So anybody with symptoms, even mild, or if you're not too sure whether it could be a symptom, please self-isolate immediately and seek a test from the NHS website, or you can call 119. And the other type of testing is the asymptomatic testing. So these are the fast LFT tests that we've been talking a lot about in the Champions, and you hear a lot in the news quite recently. So we would encourage our frontline workers, frontline staff, volunteers and carers to continue to take part in regular asymptomatic testing. So again, you can book a test for those LFT tests from the Merton Council website. Would encourage you to do so. And then the second part of the test and trace is about if you get a positive result, it's really important to stay at home to break that chain of transmission. And you will get calls. You will get calls, texts or emails from NHS Test and Trace. And so please respond to those. Tell Test and Trace who you have been in close contact with. So again, we can really keep those cases as low as we possibly can. Una has already set up next week's session. And so that next week's session is going to tell you all about Test and Trace, what it is, how it works, how the national team works, how we complement that with a local service. So I think that's going to be a really helpful session to help us all understand a little bit more about those. Vaccinations. The rollout is continuing by the NHS, supported by a number of our fantastic volunteers. Some of them are on the call earlier today and tonight, so thank you, champions, volunteers. What we can say that in line with that JCVI priority list, they're now working on to priority number 5 and 6. So that's those residents between 65 and 65 and 69. And also inviting those that are clinically vulnerable to get their jab. And as you will remember, champions, the priority list, the 1 to 9, the main focus of that is reducing the number of deaths. And so it's really important that we continue to support the vaccination rollout. And the NHS, there are a number of sessions and webinars to explore barriers to vaccination, and they're led by clinicians. So earlier this week, I was on a call with a large, significant number of our Polish and Eastern European community, and it's a fantastic webinar, all in Polish. And so again, if champions, you have small groups or organisations you think could benefit from a discussion with some clinicians around vaccinations, do let us know and we can facilitate that. Final key message, because I know we need to get on to Sarah's overview and a really interesting presentation on data and impact of COVID, is enhanced testing program in Pollard's Hill. We spoke about this last week, and this was in response, if you remember, champions, to a single case of the South African variant that was identified in the CR4 postcode in Merton. So we set up an enhanced program where to track any community spread and to restrict any further transmission. I'm delighted to say that the response from our residents, workplaces, schools and voluntary sector was amazing again. So what we have now done, we have given out 10,000 test kits, one-off asymptomatic test kits, and a good few thousand went to the mobile testing unit too. And a large percentage of those have been returned. So thank you, community. We've had a really good response to that. That program is now finished. It closed tonight. So I'm really pleased to be able to move on. And so far, no additional variants of concern have been reported in the data. It's clearly there's going to be another few weeks of the data coming back. We're working really hard with the national team to understand the findings and, really importantly, the lessons learned from that program. Because we may need to do it again, who knows. But what's really important to us is to thank the community, and we will share the findings. So whatever we find from the overview, from the enhanced testing program, we will share it with you. So variants of concern us all, clearly. The two things that we can do to tackle the impact of those VOCs is to drive down the infection numbers, and that's about following the rules. It's about hands, face and space. It's about following the guidance as it's released, and we will keep you informed through these webinars if and when those rules kind of change. And the second way to mitigate that impact of any variants that might come is around getting the vaccination. So that's my key messages tonight, champions. Thank you. Happy to answer questions in the chat or in Champions Corner, but really interested to hear what you're thinking about the opening up of society in Champions Corner. And I'll hand back to Una.
Thanks, Barry. Yes, as Barry said, please do, if you have any questions on any of the key messages today, bring them up in Champions Corner. I'm going to hand over to Sarah now, who's going to talk through her peer support group.
Thank you, Cheers. Thank you for having me on. I run a peer-to-peer support group, have done since March last year, almost a year running it now, and actually in being in the third lockdown, we've seen a lot more people attend, and obviously I think that even the strongest people out there are struggling right now, and I think that's really important to support people who need it. It's also kind of a place you can come to with, you know, wanting to share, or if you're lonely, we really do want to support you guys if you're in need or if you want to chat. It's a facilitated group on Wednesdays at 1 called Let's Stay Connected. Can I have the next one, please? You know? So as I was saying, we're really mindful in our group to establish a safe space every time. We do facilitate it around you and your unique situation, so it's very reflective. We try and get you thinking about challenges, but also realistic expectations for yourself. Trying not to put too much pressure on yourself. I know we all have a lot of pressure right now, and it's really important to, you know, take a step back and realise it may not be quite as bad as you think it is, or maybe you just want to manage your feelings like that. Please do know that we are very, very mindful of that we are all different, and asking questions to support conversations are really key to us. Next slide, please. Oh, I meant to say, if you can't understand me, I have a speech impairment, so a lot of what I'm saying is on the slides in case you miss what I say in person. So we do set expectations and boundaries. We treat every session as confidential as possible. We are non-judgmental, we're kind, we are respectful, and we are inclusive. We are mindful that everyone is different, and we give everyone the opportunity to speak or contribute in the way that they want to, either through chat or through chat and through microphone. Everyone has the right to just pause and listen. We have a few people who just come along and just want to sit there. That's fine too. We do understand that some people may need further guidance and support that we are unable to give them, and we proactively try and post in registration emails that signpost places to provide that extra extra support if anyone needs to leave, and we have a guilt-free exit so you don't feel obliged to apologise or anything, and it's always there for you if you need it. So next slide please. That's it. So please do feel free to join us. I believe the link will work in the on Friday's send out, and my email address is there if you want to find out more. I'm also available. I offer services in inclusion and strategy. I also consult on well-being, mental health, inclusive leadership. If right now you're struggling with your potentially your businesses, or you're unsure about where to start the inclusion or well-being support, please do contact me. I'm able to facilitate and support that strategically, and also training as well. So please do, if you need anything, please do get in touch, and thank you for having me on today. Thank you.
Thanks, Sarah. Barry, your hand is up.
Thank you, Una. Sarah, one of the things that I really found fascinating and really important earlier today was when you were talking about you can sometimes focus on the positives and not just the negatives of COVID-19. Can you tell us a little bit more about that?
So I guess the positives of it all is we might realise we need people more than we think. We also, I think that COVID has definitely helped us prioritise what's important and what we really have to hold dear. And I think that definitely strategically we have cut through a lot of the red tape with having to actually change the way we work in order to adapt to this new situation. And for a few months it was putting out fires, but now it's actually become much more of a strategic line and actually through that we've actually become a bit more inclusive, actually, because actually we have to recognise the disparities between people and what people need. And I think that workplaces and leaders who are questioning what people need and how they can support people in work, but through perhaps adjusting their timetable or adjusting around homeschooling, adjusting perhaps timetabling and recognising stress and knowing how to deal with it. And I think that that's been a really positive outcome of, it's hard to process something that hasn't actually finished yet, and actually that's what we talk about a lot, actually, because it hasn't finished, and how can we possibly process something that isn't over? And I think people are trying to do that, and unfortunately people get stuck because it's actually not over, and we're still getting unfortunately we're still getting people who are thinking, we have to have everything worked out, and actually it's okay not to be okay, and it's okay to talk about it. And that's why I'm here for you guys, and I hope you do at least get in touch, whatever you want to do. Yeah, and thank you, I mean, I realised I was on earlier about I've been chatting quite a bit today to you guys, but thank you. And I just got my notification for vaccine here. I'm really happy about the vaccination, and I got my booked in for Sunday. So brilliant. Cheers.
Oh, that's great news. Thank you, Sarah, and thank you for sharing that. That's it's nice to hear some positivity as well at the end of the day. So thank you. As Sarah said, we'll share all this information on Friday, and with Sarah's contact details and how to register. And if you know of anyone, if you're interested, or if you know of anyone who you think might be interested, please do share with them as well. So thank you, Sarah. Moving on to Champions Corner. Does anyone have any questions or anything that they'd like to raise? Lorna.
Yes, I was in earlier, but only half this morning, so I couldn't get my question in. My difficulty is people in certain parts of certain GP practices have been getting their vaccine in their 50s. And somebody who struggled is 61 and they haven't heard anything. And they're kind of a floater. I don't know which surgery they belong to, but they've telephoned and they were sort of told to go away sort of thing. And last week, Dr. Vassar and Mohan was so helpful that I actually phoned one of the GPs because somebody was an anti-vaxxer. So that was really helpful information. But I want to know, with this 62-year-old woman, you know, you're saying, Barry, it's 65 and people are vulnerable, and yet I know that people were going in their 50s to the Nelson and the Wilson at the weekend. I mean, what can you say to someone? Just wait and be patient?
It is, unfortunately, Lorna. It's awaiting that turn. I mean, what we're focused on in Merton, we are following those JCVI rules really closely. I think that's how the vaccination prioritisation has been put in place for specific reasons, as we've kind of touched on before. We're not deviating from those. There might be people that are frontline health and care workers that are maybe in that age group which are attending. It's really difficult for me to focus to answer about one specific case. But yeah,
I guess it could have been this particular practice had a large cohort of a certain area, or there was a lot of vaccine that day. I don't know. They certainly weren't frontline workers.
Right, yeah. Again, Lorna, I mean, it's really difficult. We are asking people to wait and to be patient. There are some stories nationally about people queue jumping, and that concerns us all. We haven't heard significant stories of that within Merton, which I'm really pleased about, because the response has been phenomenal. But Lorna, keep talking to us, and if you do hear more, then please continue to talk to us, and we can link back into our NHS colleagues as always. Thank you.
But that was really helpful that I phoned this particular GP about someone, and they were going to talk to somebody, you know, because he'd refused the vaccine. So thank you, Dr. Vassar, and I really appreciated that.
That's great. Thank you.
Thanks, Lorna. Karen, your hand is up.
Yeah, it's really about what Lorna said. I agree totally with you. I do think there are some anomalies. I can't deny that. I think what's happening is there are algorithms in place as well, which may or may not be. And so some people anyone younger should be clinically extremely vulnerable or have an underlying health condition. So you can have younger people present in the vaccine centres and you may not see what the condition is. And that can sometimes, I think, cause some problems because you won't know unless you ask them. But I have been quite concerned because I actually kind of do feel that anyone over 60, maybe because I'm an oldie myself, you know, we're at that point where I think it would be valuable to be moving on to them. But it is that people are extremely clinically vulnerable or have an underlying health condition which is very, very less obvious.
Thanks for that, Karen. That was really helpful. And you are one of the experts as well, being a volunteer on at the vaccination sites as well. So thank you. Does anyone, kind of following on from what Barry mentioned earlier, how do people feel about a potential ease in restrictions? Are people anxious about it? What do you think you'd need from us? I mean, if there's any change in restrictions, we'll go through it with you as usual. But is there anything in particular that you would like to see from us if and when there is a change?
Yes, could I say something?
Yep. Hi, Zara.
Yes, sorry. I'm speaking for me and maybe for others who have multiple problems, chronic disease, inflammation at the moment, plus long-term COVID. It's, for me, not suitable at this time to have the vaccine, if ever, but especially at this time when my disease is inflamed and not controlled. I am feeling that, I'm still at high risk and I can't help it, you know. It's unfortunately the issues that I have. But for those people who haven't been able to accept at this stage the vaccine and have to postpone it, we are still very vulnerable, and I don't feel, you know, safe, and I don't feel I'm worried about the fact that now they've accepted that yeah, people have been the most vulnerable vaccinated, and though the risk is less, but there's still some people who can't be vaccinated and that are very much at risk. Yeah. So yeah, not really looking forward to the few months coming.
Thanks for that, Zara. I think that is really helpful to understand as well people's concerns, and we will go through the ways that we can keep safe. We'll still be following hands, face, and space, and the non-pharmaceutical interventions that we speak about, as we come into a time where the restrictions are eased. But we will go through all of that in more detail, and what that looks like when the time comes as well. So we'll hopefully be able to help you feel that bit safer when it happens.
Hopefully.
Barry,
Could
is there
I just-
anything else you'd like to add to that?
Yeah. The problem is that when you are suffering from long-term COVID and you have chronic disease, this makes your chronic disease and inflame other problem, and may bring further degenerative things that would have not happened. And when we are told supposedly that there's COVID-19 clinics for long-term sufferers, that should have been open for a long time now. And when you are trying to be referred to local or even further clinics listed on the link, the official link, none have been open yet, or none of the hospital is aware that they have any clinic. And this time is crucial for us because anything makes it worse and can really be life-threatening. Yeah, and you would like to have the idea of a long-term clinic for sufferers, where you can have all the things that are linked with the symptoms, the long-term symptoms, put into one thing and research quicker.
Oh gosh.
Oh, sorry. And sorry.
It's me, sorry. Oh gosh, I've got my...
Okay.
No, it's me, sorry.
And to be referred quicker to a specialist team to sort out the damaging of long-term COVID that can really be life-threatening for us, for the much more vulnerable people like me.
Thank you, Zara. Thank you for sharing that. We spoke in the session earlier today about long COVID and how it affects people in lots of different ways. And so we're going to provide more information on long COVID in the email on Friday. But I will contact you outside of this meeting to have a conversation to see if there's anything we can do to support you, or at least signpost you into the right service. So Zara, please, thank you for sharing that. You leave that with me. We're going to get back to you. Thank you very much.
You take care. That's it. Thank you.
Thanks, Zara. Thanks, Barry. I'm just conscious we're a bit short on time. Neeraj, you had your hand up. Karen and Beck, could you put your questions into the chat box, and if we've time at the end, we can come back to them.
Shall I speak? Sorry, hi, Neeraj, I'm new to this. Sorry, it's just going back to the vaccination centre thing. I'm sorry, I just thought of that. There's a lot of chatter from my neighbours and relatives who are in their sort of early 60s that haven't been called up. Are thinking of. I think there's chatter about popping up to centres to get vaccines that are unclaimed. Now, what's the message that we should be putting out there? Because there's chatter on Nextdoor and stuff. It's all over the place and in the news. So just wondered how to message out on that.
Is that something I could give a quick, because I do every day at a different vaccine centre, one of the two. Is that something I could comment on quickly?
Yeah, go on. Go on. Thanks, Karen.
I know that a lot of these messages get out. the nurses and the medical staff have lists of vulnerable people they will contact first. There is absolutely no point popping up. They will attempt to work within the boundaries that they've got, in terms of priorities at the moment. Also, if you have a big queue outside, and we have had this happen, nobody's going to get it, because it's just going to be, I think you need to be aware of that because it's going to cause more problems in the future. And that's a really big discussion point that I think has probably occurred already. So I would ask you to be really patient. I am a real, as I said, champion of your age group. You're not far off.
It's not my age group. It's just the
60-year-old. Sorry, Neeraj.
No, that's all right.
You're probably younger. I'm sorry.
It was going so well, Karen.
I am like you, very concerned. But what's happened is that vulnerable people are taking obvious priority, and so you're next. Not you. Your group are next. And I don't think it will be long. I really don't think it will be long.
The message I should give out is all the stuff you hear about vaccines being thrown away.
There is nothing. Can I say nothing's ever? Honestly, I can honestly attest to the fact, because I've stayed behind for 1 hour plus beyond my volunteering time, because they have called someone in who is appropriate for the vaccine, and we've waited. And I've been there beyond 8 o'clock at night to deal with that. So just to say, we really throw nothing away.
No, I mean, it's a Pfizer probably, wasn't it? I think that's where it all stemmed
from. Pfizer does not get thrown. None of them get. They're really Pfizer. They know the day it's coming in. So they might know. And they work really hard, all of it. I can honestly guarantee you that all the vaccine, the issue does not lie there. It's never thrown away.
So Karen, let me just close that. So it's really important that we're patient. We wait for that invite. The NHS, as Karen said, won't send text message or put or messages on Facebook saying, please pop down to the centre. There are some vaccines going. There's a structured planned programme for that, and it's being supported by Karen and our amazing volunteers and our clinicians. So the key message is to wait for that invite. There are, and as Karen said absolutely rightly, there is a plan B to make sure that those vaccines are used most appropriately.
Yeah.
Karen, thank you for that. Really appreciate that.
Thank you, Karen. Cheers.
Thank you, Karen. Thanks, Neeraj. I'm just going to move on because we're a little bit short of time. But if you do have questions, please do put them in the chat box. We'll get to them on Friday. Our workshop theme today is the early analysis of COVID impacts on BAME populations in Merton. We know that a lot of people have been disproportionately impacted by COVID. Younger people, older people, people with learning disabilities, carers, and BAME communities. So today we're just going to have a look at the data that we have for BAME communities in Merton. And we have Anita Davies, who's our Senior Public Health Principal, and Sylvia Gary as well, our Consultant in Public Health, on the call, who are going to present the information and answer any questions. So I'll hand over to you, Anita.
Thank you, Una. Good evening to everyone. So we'll quickly go through these slides. There are quite a few slides, and you will have a copy and can come back to us with questions. Next slide, please. So let's look at the overview of the COVID pandemic in Merton. Merton recorded its first case of COVID-19 on the 26th of February 2020. Since the start of the pandemic, Merton has recorded 15,326 confirmed cases of COVID-19. And as of 29th of January this year, Merton has registered a total of 404 deaths where COVID was mentioned on the death certificate. Next. So when we talk about COVID and we think about the impacts, we usually tend to think about the direct health impacts of COVID, but there are many other impacts. So if we start looking at the long-term indirect health impacts that are linked to social determinants of health, for example, the social economic inequalities, unemployment, these are all long-term indirect effects of COVID. There are short-term indirect health impacts on otherwise healthy, for example, mental health consequences of isolation. I think that was mentioned by someone in the group today. And then the lack of school meals during school closures, it affects the children. When we look at the immediate indirect impacts on other patients that need health care, especially in ICU. So you have patients who are currently receiving like cancer care or emergency treatments, and COVID has affected this. Next slide, please. So we begin to think it's the same pandemic, but they're unequal impacts. And how have people experienced the pandemics differently? So if we look at England, in England, 50% of people living in the poorest areas are at the highest risk from COVID-19. And Blacks and minority ethnic communities are more affected by COVID-19. And then we look at disabled people that have been hit particularly hard, 2 to 3 times more than other members of the population. Younger people are most likely to lose employment, and health and social care workers have an increased risk of diverse mental health outcomes. Next. Now let's look at demographics for BAME in Merton, and this is for 2020. So Merton current resident population is 2,102,658, of which 37% is made up of the BAME population, and 63% is from a white British, white Irish, and other white population backgrounds. And if you look on my right, you can see the breakdown of percentages of all the different ethnicities. Next, please. Now we know that Merton is made up of the West and the East, and we know that there are disparities in the different parts of the borough. So Merton health and life expectancy is actually better than other London boroughs. However, there is deprivation and social inequality exists. So the eastern half has younger, poorer, ethnically diverse, and the western half is whiter, older, and richer. And when we look at the ill health and premature deaths in Merton, it's usually due to cancer, circulatory diseases, unhealthy diet, smoking, lack of physical exercise, and alcohol. Next. So let's look at the direct impacts of COVID in Merton. Next. Now, if we just look at tests in Merton by ethnicity from the 1st of January 2020 to the 4th of January 2021, so that's like over a year period. If you look at the number of people who were tested in relation to the percentage of ethnicity in the population, let's go down to the white population, and you can see that 64.12% were actually tested. Now, if you look to your right, you can see tested positive, and you can see that when you go to the top, in the Asian population, more people in that population have tested positive than their representation in the population. Next, please. Now, let's look at the positive cases in Merton by ethnicity, and we compare the first wave with the second wave, and then the ethnic breakdown. And you can see the pattern is very similar in the first wave, second wave, and in proportion to the ethnic breakdown. Next, please. Now, in Merton, the mortality rates are linked with the place of birth, and this is a proxy. This does not necessarily tell your ethnicity, but this is the way that it's recorded in the whole of the UK. And so you look at the figures, and it's pretty much Merton versus COVID deaths. And then you look at what is done for the UK, and you see that 48% of COVID deaths in April were UK born, and 52% were non-UK born. So 1 in 5 of COVID deaths in April were to people born in Asia. However, we know that is a proxy because there are people who are of Asian descent who are not necessarily born in Asia, but born in the UK. Next, please. Now, this slide, it's a busy slide. It shows you the 7-day rolling COVID case rates per 100,000 in Merton by deprivation over time. So the darker areas are the higher deprivation areas. And so you look, it's more towards the left. This is done by postcode, not by individual. And the higher rates of cases amongst the more deprived cases are grouped throughout of January. Next, please. This is a similar slide. And the higher rate of cases amongst, now this is showing the different ethnicities. So the higher cases are amongst the Blacks, Pakistani, Bangladeshi groups in Merton in January. Next, please. Now we know that there are disparities in the risk and outcome of COVID, and Public Health England did this review in 2020, and we find that people from BAME backgrounds are disproportionately affected by COVID rates of infection or hospital admission or mortality. And the underlying determinants are deprivation, occupation, housing, and the comorbidities. So you can see with ethnicity, we've talked about that in the previous slides. With deprivation, we've talked about that. And we know that the comorbidities of diabetes, hypertension, chronic kidney disease, COPD, dementia are found in the BAME groups. Next, please. Now, occupation. We know that people working in certain occupations are found to have higher incidences of COVID. So for example, health and social care workers, security guards, transport workers, chefs, low-skilled construction workers. We know that the BAME groups are more likely to work in these occupations, and 50% of London's NHS and CCG staff are from the BAME group. Now, 8,475 BAME people in Merton work in these jobs, and that makes up 70% of the BAME population in Merton. Housing is another issue, and we do know that BAME families have multi-generational housing. And again, the slide shows you the different ethnicities. If you look further down, you'll see 30% of the Bangladeshis, 18 of the Pakistanis, 16 of Black Africans, and 2% of white British in relation to housing density. 9% of Merton BAME households are overcrowded. Next, please. Let's look at indirect impacts. Next. Now, this is quite a busy slide, but basically it's just showing you social economic impacts of COVID-19 on Londoners. And so the similar things will be happening in Merton. We know that household finances is something which younger and BAME Londoners were more likely to report. There's a change in employment and work from May of 2020. And then if you look at proportion behind in their household bills since May 2020, proportion who used a food bank in May, and the proportion who find it very difficult financially, you can see the differences between the BAME and the white population. Next. And the same for proportion who felt more productive in September. This is interesting because it's like there's a positive impact to some extent. And then proportion who were unable to eat healthily, and proportion who reported binge drinking. But then you see there's a proportion that have had strengthened relationships with their children, and this was found in September of 2020. Next, please. Now, health and well-being. There were some people who, during the first lockdown, were able to increase or decrease physical activity. And you see that the Black and Asian groups reported higher levels of more physical activity during the first lockdown. Londoners had a feeling of loneliness in the lockdown in 2020. And then when you look at depression, definitely there's one of the effects of COVID in 2020. Next, please. So now we listen and work with the communities, and this helps us in moving things forward. Next, please. So the engagement programs to date, we're working with communities in key principles of the HWBB and the central part of the work in Merton. It's important that we listen and work with the communities to build upon the existing networks like this network and to strengthen the capacity and the resourcefulness of all local organizations and groups. Working together increases the reach of core messages, and COVID impacts all members of communities. Even though we know that it impacts some more than others, we are particularly focusing on BAME groups, carers, older people, children, and young people, and those with learning disabilities. Support is given to the vulnerable to reduce the impact of COVID. All the information that we get and the insights from the community are used to improve services. And the work today includes community champions like yourself, young adult community champions. Merton has given 20 grants so far for the amount of 79k and engaged with key communities like the Polish and Eastern European and Merton MenCap. Next, please. Now, the BAME voice has been commissioned by the London Borough of Merton to understand what's happening out there, and information that is fed back to us can be used to improve services. Now you can see that there are some preliminary findings, and you can read what's on the slide. The areas for action will be used to improve support groups, and the final report will be due by the end of February. Next, please. Next slide.
Can you see that slide, the next steps and actions?
Okay, yes, now I can see it. Right. Now, the HWBB community subgroups have been extended for 6 months, so that is up till September 2021. And the focus will be on tackling vaccine hesitancy as a key element in the exacerbation of inequalities. Subgroups will also continue to help address misunderstandings and misinformation, because there's a lot of that out there. And we will continue to build and strengthen networks and to increase the reach across the community. We continue to work jointly with the NHS and partners on a planned collaborative approach to engage to tackle health inequalities. Next. So thank you for listening. We're open for questions. We also have various links that you can go to get more information. Thank you.
Thanks, Anita. Does anyone have any questions on that presentation for Anita and Sylvia? You've covered it all so well, Anita.
She really has. It was very interesting.
Oh, I see a few hands up. Aziza.
This is probably clarifying, but I wanted to know how you're logging the deaths and births within the area, because neither hospital that's used in Merton is within the borough. St George's is in Wandsworth and St Heliers is in Sutton. And I know from, for example, my husband passing, his death was registered in Sutton, and the birth of all my children were either Sutton registered or Wandsworth. So it's how we're logging this, or is it based on our postcodes? Thank you. Sorry to be.
No, that's an interesting question. Sylvia, can I pass that on to you, please?
Yeah, absolutely. And it's a really good question. So essentially, there are loads of different ways of looking at birth and death data. But the main way, the data that we look at is of Merton residents. So that's someone whose current postcode is listed as a Merton postcode. There's going to be a little bit of ambiguity around people who've been recently admitted to care homes. You have to have been at that address for a certain period of time. But for example, if someone were to pass away in hospital, that would be, but they were normally a Merton resident, that would be counted as a Merton resident. Does that make sense? The data that we get, by the way, and there are different ways of registering data, which is where there's a bit of a complication. We just use the Office of National Statistics, ONS, and that's the national database. So what you'll find happens is there's always a delay of about 10 days before we count the data around deaths. And that's because it comes through the official channels. And there is a local number, but confusingly, that only counts the deaths within Merton. So we focus on Merton residents in all of our presentations. I hope that answers your question, but do let me know if that needs clarification.
Thanks, Sylvia. Aziza, does that cover your question?
My phone. Sorry, my phone, my laptop is jammed, but that does. Thank you.
Thank you. Thanks, Aziza. Thanks, Sylvia. Karen, your hand is up.
Yeah, I have a question. I think you do a great job. First of all, I'd like to say thank you very much for a very interesting presentation. Thank you. Is it Anita?
Yes, it is. Yeah. You're welcome.
I see repeatedly the Polish community and the relationships that we forged here with an organisation. I was just wondering how we're engaging more with Asian communities and other non-white communities. I feel we haven't got maybe the representation in the same way. And that's a question for Barry, really, I think.
Yeah, thanks, Karen. Really right. It's the right question to ask as well, particularly looking at that data about that disproportionate impact in wave 2 on the Asian community. So we've got a range of different ways to engage with different groups. So we've got the Polish community. We've commissioned BAME Voice, who are engaging with Black and Asian groups across the borough. The Merton Giving grants are also really interesting because those 16 grants that have been given out are through different organisations. So there's 16 different organisations, and there are from some Asian groups, community groups in that list. We're also
to have some of them come and talk to us, I think.
What a great idea. Yeah, because again,
we haven't as yet, and I think, well, I have missed 1 or 2 sessions, so I apologise, but
oh, you're right.
I'd really like to see that happen.
That sounds amazing because we can give an overview, and that's why we've got this 5-minute slot in between the key messages, and I'd love for you to speak about your experiences, by the way, in that slot in the future. But I think you're right, we can get some of those community groups to talk about what they've done, like we had Slavek from the Association of Polish Families. But we're also engaging with faith organisations and faith groups. But saying all that, we've done some good stuff. We've got champions, we've got grants, we've got some really strong connections in the community. Sylvia and I were talking about this a little bit earlier this afternoon. we need to do more of it. We need to get more. And so one of the posts that we're just about to recruit to is a community engagement post to do even more engagement or even more recruitment, so we can make sure that we're working hand in hand with those communities to tell us what's happening in the community, but also to come up with solutions. We, as I've said to you champions before, I don't have all the answers, I can't have all the answers, but by listening to the right communities between us, we can come up with the right solutions. But Karen, I love your idea about getting some of those community groups, and I know that Beck is really well connected as well through his role as Health Watch. So that's, yeah, thank you, Karen.
Can I just ask one very quick question? You don't even have to answer it, but it's interesting to me that these communities are more effective in the UK, because it strikes me that these communities, for example, in India, the impact, there's some very interesting articles about why is it not having such an impact in certain parts of the world where people from those cultures here are being impacted far more. So that's quite an interesting fact, I think, in and of itself. There's maybe more research.
As I can see, Sylvia's got a hand up, so more than happy to bring Sylvia into the conversation.
Thanks, Barry. I mean, I think that's a really, really interesting point, Karen. And I think there's one thing about COVID that, quite frankly, we are going to be dissecting this information for months and years to come. We are nowhere near understanding everything that's going on with COVID. But it's also an indicator of what's going on locally, that it's really important that we understand that a lot of the inequality, it's around deprivation, it's around the type of job you do, and everything that we talk about, it's to do with what's your risk of physically getting COVID in the first place, like what's your exposure risk, what's the dose that you're likely exposed to, then how easy do you find it? Are there any blocks to getting healthcare? And then what happens next in terms of societal impacts, economic impacts, your kind of well-being impacts, and that's actually a really important thing that I think we need to always bear in mind whenever we're looking at any of this data, as so much of it is societal underlying factors. But yeah, we have got our eye on what's going on in other countries, and I have to say we are going to be looking at this info for a very long time to try and work out and actually learn and work out, like, I think, you know, there's so much learning to happen across all the different cultures and countries.
Thank you, Sylvia. Thank you, Karen. That was a really interesting point. Beck, just before we go, you've got your hand up.
Yeah, thanks, Una. Yeah, thanks, Anita and Sylvia. Just a quick one. It's basically in respect of the next steps, improving services. Obviously, it's going to be quite challenging because there is obviously been in conversations where looking to make savings in services like dementia services. When we talk about measuring the improvements that have been made, obviously, because I think that's where we want to go, is it already potentially threaded into the annual resident survey that Merton conducts, or is that something that actually could be added to, just to make sure we're getting feedback from the BAME communities in respect of whether some of these inequalities are being addressed? Or I suppose it could be part of the joint needs strategic assessment as well, but is that something that is being looked at?
See, Sylvia's waving.
Oh, Sylvia, sorry.
Hi. I'm trying to be good, Una, and wait my turn, sorry. So you're absolutely right, and our joint strategic needs assessment is actually currently is actually underway right now. Now, what we're trying to do is to time it rightly so we can correctly capture all of this to try and understand. Look, quite frankly, it's a constantly evolving picture. You know, where we are now is different to where we were last year, and I think what we don't want to do is just do a static, right, this is where we are, and then never look at it again. This is a constantly evolving situation, and what COVID has shown us is it's sort of shone a spotlight on inequalities. And the JSNA, the Joint Strategic Needs Assessment, has always looked at inequalities, and this gives us an opportunity to really try and bring all that information together to help inform what we do. And part of the JSNA is engaging with everyone to try and find out those impacts. But I think it's a constant conversation that needs to continue to take place in the coming months, years. I don't think it's going to go anytime soon, or be resolved anytime soon, sorry, is what I was trying to say.
Thanks, Sylvia. Thank you, Beck, for that question as well. Just moving on to next steps. We'll continue to answer your questions, so please do, if you have any, send me an email, and I'll pull them together and we'll share them with you and our responses on Friday as usual. Our next drop-in meeting is next Wednesday, the 24th of February. So the same times, 12 to 1 and 7 to 8. And as Barry mentioned earlier, we'll be discussing contact tracing and COVID marshals as well in our workshop theme. If you haven't already, could we ask that you just sign up to the network using the online form on the screen there. I'll share the slides with you on Friday and you'll be able to do so, just to ensure that you receive all our emails every week, and the links to drop in as well. Thank you all for joining us this evening. Thank you, Sarah, Anita and Sylvia as well. Really interesting session this evening. I hope you all have a lovely evening.
Brilliant. Thank you, everyone. Thank you. Bye-bye.
Thank you.